This depends on the follow-up. I may increase the dose of the antidepressant, or I may, advise them to use the anxiolytic, as needed.
Okay. For how long do they have to be on this medication?
Okay. Now this is the part where my patients don't like what I'm going to say to them, because research tells us that we need, 1 to 2 years course of this therapy, because the research is telling us that panic disorders, anxiety disorders tend to have a chronic course. So the longer patients stay healthy, free of panic attacks or free of obsessive compulsive symptoms, then they have less chance of relapse, less risk of relapse. If they take it for a short time and they stop, then they are at risk of having the symptoms coming back again. So I tell my patients, 1 to 2 years, and I encourage them to stay on it for 2 years.
Is there any long-term side effects that people have to be aware about?
The unpleasant side effect is that people don't like is weight gain.
Okay.
This is the unpleasant side effect that's, and I had a patient, for example, yesterday I saw him. He has panic disorder, and he's really to the point that he doesn't leave the home now. He used to be very active, a businessman, going and trading and, back and forth. Now he is almost housebound because of these panic attacks. Now,
so these panic attacks embarrassed him, you mean, in front of people?
No, he's afraid to go out. Okay. He's afraid to go out, then, now...
Can we consider this as specific phobia, or...?
This is called agoraphobia.
Oh, okay.
Okay, which we didn't mention. Agoraphobia is situations where patients fear that they might not get help. So they avoid traveling long distance. They avoid going into closed places.
That has this another name, like a claustrophobia, right?
No, but this is agoraphobia is fear of being in situations where escape might not be possible.
Dr. Abdullah, I think people are interested about that, and we have a call from Qasim. Good evening, Qasim.
Hello, good evening. Assalamu alaikum.
Wa alaikum salam wa rahmatullah.
I have one question for the doctor.
Yes, go ahead, please.
Hello, doctor. I am too young to suffer from this problem. I just wanted your opinion regarding this. I'm around 35 years, and for the past 1 year, I feel that I tend to forget things easily. What you call it, amnesia.
Mm-hmm.
Do you think this problem is temporary, or should I consult someone? Does it come under psychiatric problems in the first place?
How old are you?
35.
35. Besides forgetting, Qasim, do you have any other symptoms?
No, not really. I don't recall things, I have to think over the things, and after some time, I have to gather a lot.
I see. Well, okay.
Any questions for him? Okay.
No.
Okay, thank you, Qasim.
If he doesn't have any other symptoms, I mean, forgetfulness or poor concentration can happen in anxiety, can happen in depression. Qasim says he doesn't have any other symptoms. The most common reason for forgetting is having too much on your mind.
Okay.
Okay. So I don't know. Maybe this is the case with Qasim. Maybe he has such a busy schedule that, remembering things, recalling things, even registering things is proving to be difficult. If this is not the case, then I think you should, consult a doctor to see if there is anything else is going on.
Do you recommend to consult a family doctor before?
A family doctor, and then if the family doctor feels that needs to see a psychiatrist, then why not?
Do you see usually patients with the similar problem?
Just for simple forgetfulness, no.
Okay.
No. But at this age, at older age, people who are having from dementia,
yeah.
Older people, yes, I see people. But younger people with forgetfulness, I don't usually see.
Okay. Let's go back to the interesting topic you mentioned about agoraphobia.
So agoraphobia is patients who have panic disorder also have this fear of being in a situation where escape might not be possible. So if they go into a lecture, they sit in the last row because they are easy to go by the door and escape if they have the panic symptoms. If they are praying in the mosque, they avoid being in the front row. They always at the last row, so escape is easy. If they are traveling, they have someone with them, or they have the mobile, or they travel short distance because they are afraid if they travel long distance, something might happen to them, nobody will rescue them, and then they will. So this patient has panic disorder and agoraphobia, and he's housebound. He was on one of these medications, the antidepressants, and he had weight gain. It helped him, but he gave it up because of the weight gain.
Okay.
And, you know, so that's unfortunate, or, you know, so I tell my patients to exercise, to do some kind of diet, and that's the only way to go about weight gain.
But they can overcome the problem
They
with
can.
exercising and good dieting, right?
They can,
Okay.
they can.
Now, other forms of specific phobias. You mentioned about this is a fear from going outside. What about patients who are afraid from needles, patients who are afraid
Okay.
from being inside the
So
closed areas?
this is called a specific phobia.
Okay.
Okay.
Have a slide
And-
for that you'd like to comment
And
on?
phobias are situations that when the patient is exposed to will produce fear and apprehension
Okay.
and anxiety. So it can be objects or it can be a situation. So object, for example, and these are the types of phobias that
Our director
we'll
now
show
the
shortly.
slides, yeah?
We have animal phobia.
Okay.
Okay, most common people, dogs or spiders or snakes. Natural, there are phobias of natural environment, which is height,
Okay.
you know, fear of height. Some people are fear of water. It's not common, but height is the commonest. Blood injection, injury type, so this is the needle injection phobia. And situational type, which is being in an elevator, being on a bridge, or flying. Flying phobia is very common.
Or meeting people?
No, this is different.
This is something different.
This is social phobia.
Oh, okay.
This is social phobia, different class. These are called specific phobias.
Okay.
Okay?
So let's talk about them. About animal and type. How common this one in Kuwait?
As I said, people with phobias, they are the commonest anxiety disorders, and they are the commonest disorders in psychiatry, phobias. But we rarely see them. They don't come to see us.
Dr. Abdullah, I'll interrupt you for a minute.
Okay.
We have a call from Hassa. Good evening, Hassa.
Hello.
Hello, yes?
Hello, good evening.
Good evening.
I have a question, please.
Yes, go ahead, please.
I have a fear of
Much, much.
height,
I
and
can't hear.
I'd like to know what I could do instead of going to a doctor to improve my situation.
Yes?
What's the best thing I could do? I mean, some tips or...
Can you repeat your question, please, Hassa?
Excuse me?
Can you repeat your question, please?
Yes. I have a fear of height.
Fear of height.
Yes. And
Okay.
instead of going to a doctor, what could I do to improve my situation?
Okay. Okay, so we are just starting to talk about phobia, so be with us and we will continue our
Okay.
discussion. So
Yes,
thank you
you.
for calling, Hassan.
Thank you.
Okay, so she's talking about fear of height.
Fear of
What
height,
What
yes.
she can do before going to the doctor? Can she treat that by herself, or she needs to see us?
Okay, the best treatment for phobias is what we call gradual exposure, or in our term in psychiatry we say desensitization. The patient is very sensitive to, in her example, height. Okay, so we are trying to desensitize her from this. This happened on a gradual basis and through exposure. So we do, you know, we may do initially some cognitive assessment, and we try to understand what is her, you know, fear, what are the links, maybe there is something from the past. And after that, we go to the exposure, which is the practical side of the therapy, and the most important side of the therapy. Patients don't like it because you are making them anxious.
Okay.
But this is the best way to treat anxiety, to treat phobias, is exposing them to the feared situation, object or situation, gradually.
Do they need to take a medication?
Sometimes medication can help, and it's the same group of medication that I mentioned earlier.
Okay.
It's the antidepressants, anti-anxiety medications, but they need to take it for a long time I mean, not long time. They need to take it regularly for 1 or 2 years. But
desensitization is better because it
for them, desensitization is better because really it is more effective, and you don't need to take a treatment for 1 or 2 years. And but the thing is that patients are reluctant to do it because you produce the anxiety symptoms. But it is the best way.
But it's successful?
It is the best treatment.
Can it relapses even after they get rid of these fears?
Less, maybe 10 to 20% chance of relapse, up to 75% rate of improvement.
Okay. Now, this is what you call is natural environment type or situational type?
No, the natural environment is the height.
Okay. Is there another types of phobias that belong to this group as natural environment type? Other than fear of height?
Basically, you can say this is the common.
The common type.
Yes.
What about the animal?
Animal, like I mentioned, some people are afraid of dogs. Few are cats, spiders, snakes. I mean, snakes. it's natural to feel. But I mean, if someone is seeing a snake in a zoo, in a box, and they're still having panic, this is abnormal because it's safe. But if a snake is on the loose, it's normal to have an abnormal reaction.
What about people
or a fearful reaction?
Walk beside dogs which look calm and tied very well, and people start to jump?
Yes, they have dog phobia.
Okay, it's very common.
It is common.
Yeah.
It is common, and again, the best thing is the gradual exposure. Gradual exposure.
Now, about blood injection injuries type, needle phobias.
Yes.
People, sometimes go to the hospital and they tell the groups that, okay, I'm afraid from needles, I may faint.
Yes.
So what to do with these people? How to?
Okay, two things that can be helpful. Two things that can be helpful for these patients is the relaxation technique and the deep breathing, or what we call the diaphragmatic breathing.
Okay.
Mostly when we breathe, and this requires some training by the therapist. It can be a psychiatrist or a psychologist or, a trained nurse. Now, when we breathe, we mostly use our chest muscles. We use our chest muscles. This is normally. But for the deep breathing, you use your abdominal muscles. And this requires some training because this kind of breathing is more relaxing for the patient.
The abdominal type.
The abdominal type, or we call diaphragmatic or deep breathing. The relaxation technique is, people have misconception about hypnotherapy. They think hypnotherapy is some kind of, a fantastic thing. But hypnotherapy is basically a relaxation technique. It is, we train the patient to relax through imagination and through relaxing their muscles. So they sit or they lie down, because when you are relaxed, you don't want any points when there is, sitting on a chair or crossing your legs, because whenever there is tension, there is no relaxation. So they have to be lying, in a comfortable couch or lying flat. And then they close their eyes and, imagining, something beautiful, something they like, and talking to their muscles from the head to the toe. And the therapist trained them to relax all these muscles, and this technique can even be used for patients who have pain problems, chronic back pain. It helps them to relax and help them with the pain. Some use them for even to do minor surgery, without anesthetic. Yeah, without local anesthetic. So it is quite useful. It is quite powerful, and it is proven to help patients with anxiety and with other conditions.
Do you teach these things at the hospital?
Not to a great extent, but I do use them, when it's indicated.
Okay. Now,
so for patients with injection, or needle phobia, we try to use this as much as we can.
What if it failed? Is there another way of treatment?
Maybe give them benzodiazepine